Knock, knock, knock. Hello, Miss Tidwell. I'm Mila. I'm going to be your nurse today.
Hello. Alright, so this is Miss Tidwell. She's 31. She's a G3P1. She's currently 14 weeks pregnant. She's here because she's been extremely nauseous and vomiting throughout most of her pregnancy. It's been so bad that she's lost about 10 pounds over the past 2 weeks. She's vomiting a greenish liquid, which is most likely bile. She hasn't been able to keep anything down. Since she's been here, she hasn't been able to tolerate any food or fluids for the past 2 days. Her doctor is Dr. Stephanie. She suspects that she has Hyperemesis Gravidarum. So she's in PO and she's bedfast. She's on a D5 LR with multivitamins running continuously. She's got an order of 8 milligrams of Zofran, ordered every 6 hours at 25 mLs an hour for her nausea and vomiting. She's oriented, but she's lethargic. She's got poor skin turgor. Her urine's dark and concentrated. Breath's free odor, which is synonymous with acidosis. Her lungs sound good, clear, and her respirations are 28. Her heart rate's 92. Her blood pressure is 108/84. And her oral temperature is 99.8. Fetal heart tones, 152, 156 in the left lower quadrant. And her recent labs show a low calcium, chloride, phosphorus. She's got a low sodium, high hematocrit, high platelet count.
Okay.
She's got limited visitors right now. Only her parents for now. Her husband's out of town.
Okay. So, Miss Tidwell, how are you feeling now?
I'm not feeling very good. I'm lightheaded and my throat hurts.
I'm sorry, sweetie. Let me check you out.
All right, I'll see you tonight.
Okay.
Okay.
Will I be able to eat something soon?
Well, at the moment, the doctor has you NPL since you can't keep anything down.
Is the doctor going to come see me today?
Yeah, she's going to come in maybe this evening. Dr. Stephanie is really good about coming in the morning, really early to see her patients. Okay?
Okay.
Here is 3 heart tone. Okay, take a deep breath. Take a deep breath. Okay. And check, make sure, read the monitor. Okay.
Get my day.
Baby sounds strong. You're having no contractions. Okay. So, do you need an emesis bag or anything?
Yes. Can you get me a emesis basin so that I don't throw all over my bed again?
Okay, I sure can. So, do you need anything else at the moment?
No.
Okay, I'll be back, okay?
Well, how are you doing today?
Hi, Dr. Stephanie. I'm not really feeling much better. I'm more lightheaded than yesterday and my throat's hurting. I'm really hungry.
Okay, well, I'm so sorry that you're not feeling good today. We do have to keep you NPO right now. You're not allowed to take anything by mouth because you had, these episodes of nausea and vomiting. So we have to get that cleared up before we can, give you any food because, the smells of food may, just cause that recurrent nausea and vomiting. So we're going to just keep you NPO right now until we get the nausea and vomiting cleared, okay?
Okay, well, can you tell me what's wrong with me and why I'm vomiting so much?
Okay, so now with your other pregnancies, did you experience any problems with this same thing?
Yes, I did.
You did? Okay. And what about your mom, or do you have any sisters that when they were pregnant, did they have issues?
My sister did.
Okay. All right. So sometimes hyperemesis gravidarum can run in, can have a genetic component to it. So if your mother had this issue and your sister had this issue, that could put you at a higher risk for having it also, and you did have it with your previous pregnancy. So, most women do have problems with nausea and vomiting, especially in the first trimester. But with hyperemesis, we see this when women have that persistent nausea and vomiting. it can start anywhere between 5 weeks gestation and go up into 16 weeks gestation, but sometimes it can even go further than that, up into the third trimester. But some characteristics that we may see in patients include dehydration. We can may have some neurologic changes, and that's some of the things that we see with you. And some actual causes is really not, we really don't know exactly the cause, but we do believe that the change in hormone levels in the body during pregnancy can contribute to hyperemesis. So like we see a correlation between high levels of HCG at the beginning of the pregnancy with more nausea and vomiting. So relaxin is another hormone that's increased, and relaxin just it decreases the smooth muscles in your stomach, relaxing the muscles in the stomach area. And also we see increased levels of estrogen and progesterone, and they decrease gastric motility and cause gastric reflux. So it's a combination of those higher levels of hormones that's kind of a good formula to increase the risk of nausea and vomiting.
Is my baby gonna be okay?
Yeah, what we're doing now, we have you here. I'm glad you came in, because our main focus is you're very dehydrated. Your lab work shows that, and you've had a lot of nausea and vomiting. You hadn't been able to keep anything down. So the main thing we're doing, we're giving you some IV fluids to help rehydrate you, because we don't want you to be dehydrated. That's getting those electrolytes out of balance. And also when you're dehydrated during pregnancy, that you can secrete oxytocin, and that can cause contractions, and we don't want that. So our main focus is getting you hydrated, and so we have you hooked up to the IV fluids to help rehydrate you, but also help with getting your electrolytes back in balance. And also you hadn't been able to eat anything, so what I want to do is I want to put a nasogastric tube down through your nose to your stomach to feed you.
A what?
A nasogastric tube. And so this is just a way that you can get some nutrition, because you're having trouble with keeping things down right now. You can't, with that persistent nausea and vomiting, you're having problems keeping things down. So we're just gonna feed you through a tube.
I don't
Give
know
you some
about
nutrition.
that. I wish my husband was here to help me make these decisions. Would you mind talking to him?
Absolutely. I'll be happy to give him a call. Can you call him right now while I'm in here?
Sure.
Okay.
Hi, Miss Tidwell. I'm here to change your fluids.
Why are you giving me so much fluid?
So this particular IV fluid is to prevent you from getting dehydrated. Since you've been nauseous and vomiting so much, and you aren't able to keep anything down, it's important that we keep you hydrated. Dehydration can be detrimental to the baby as far as you having contractions, and we don't want you to do you too early for that. And I also have some Zofran, which will help with your nausea. How's your nausea been?
It's been okay.
Okay. Can you verify your name and date of birth for me?
Mary Beth Tidwell, 2389.
Okay. Need something for a talk to?
I think it's just the nausea.
Okay. Okay, I just wanted to make sure. I want you to be as comfortable as possible. Let's prime this line. Okay. And this is for your nausea. Okay, I also brought your emesis bag in case you need them. I want to encourage you to do mouth care. That can also help with your nausea. It's just a little scrub brush that I can bring to you that you wet it and just clean out your mouth. And also, I think I'll ask Dr. Stephanie if you can take a shower. That'll probably help you feel better.
Yeah, I think I want to take a shower.
Okay.
I need to get up.
So being that you have been lightheaded, I won't allow you to do it by yourself. So I'll help you. So with that, you have two options. You could do a bed bath where you lay in the bed and I just give you a bath. Or you can get up in the shower, but I'll have to help you.
I think I would rather take a shower.
Okay.
I'm tired of sitting in the bed so much.
Great. Looking at the field heart rate, everything looks good. The fetal heart rate at the moment is 142 beats a minute, so that's good.
142.
Yeah,
That seems high.
Well, normal fetal heart rate for a fetus is 110 to 160, so that's pretty good. That's perfect actually. That's in the range we want it to be. So it's not like ours, which is supposed to be 50 to 100.
Oh, okay.
So, yeah. So I know everything is a bit overwhelming and you feel like you've lost all control, but we're here. We're going to do the best that we can for you. We want to make sure that we give you the best care possible. And also, Dr. Stephanie has ordered an NG tube. Did she tell you that?
She did.
Okay, so with that procedure, I'm going to sit you up and I'm going to take a nasogastric tube. It's just a clear tube about this long. I'm going to measure it. And then I'm going to insert into your nose and ask you to swallow. And so I can put it down into your stomach. Okay?
Okay.
So that's gonna, and then we're gonna feed you food, well, nutrition through that tube, okay?
Okay, thank you. I really appreciate you explaining that to me.
No problem.
I'm also feeling a little down.
Mhm.
Is there someone that I can speak to?
Sure. I understand that this can be overwhelming, and you have lost control. You feel like you've lost control of your pregnancy. So, would you like me to set up a consult with a psychiatrist?
Yes, I would appreciate that.
Okay. They can help you cope with your feelings. Okay. So, while I'm speaking with the doctor, I'll recommend a consult with the homeopathic doctor that can give you more, just more mechanisms to help you cope with, help with the nausea and vomiting, complementary medicine, maybe some acupuncture or some Reiki or something like that. And also, I'll ask for a consult with a registered dietitian with a T, so that they can give you meal ideas and how to ways to help you cook your food and what foods to eat that won't upset your stomach. Okay.
Okay, if you think that I'll benefit from speaking with someone, I really want to.
I do. So, I'll go get my supplies for the NG tube. Do you need anything else at the moment?
No, not right now.